A young person with generalized pains and hip enthesitis on MRI. What does that mean? Hello, this is Dr. Siddharth Ambar, physician here at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. Let's discuss a case that was mentioned to me by one of the viewers from our content. Before we get started, quick caveat to this individual or to anybody else that's watching. If I'm not your physician, meaning I have not actually seen you, then I'm not your physician. This is not meant to replace your individual physician's diagnosis or treatment suggestions. Take this with a grain of salt. Take it in what it's meant to be, which is educational. And I hopefully it gives some guidance for what next steps you should consider doing, but you still need to see your physician. All right, so the brief kind of synopsis of what the question was a 35-year-old who had generalized pains, including hands and wrists, hips, lower back, buttock area, normal CRP test, and an MRI that showed enthesitis at both hips. Interesting. Let's talk about this. So this presentation is interesting for a few reasons. Number one, this is a relatively young person, 35-year-old, having pains for several years. That's progressive. Both sides of the body, upper and lower extremities. So the nature of something being so widespread, progressive in a young person, you do need to consider some potential systemic etiologies. And by systemic, I mean things like your immune system or hormone system or something else that could be affecting your generalized body. That's in contrast to, let's say, you happen to be a carpenter and you've got shoulder pain because you're doing a lot of overhead activity, right? That's a very specific issue. So first and foremost, the presentation is interesting and does deserve more query and investigation. Number two, the individual mentions that their inflammation level, CRP, is normal. That is one marker of inflammation. There's another one that's frequently checked, the SED rate. The fact that it's normal does not rule out that you could have an autoimmune or inflammatory condition. Inflammatory markers are one piece of the puzzle. In some people, they are very classically high. In other people, they're not. That's just how it is. The nature of autoimmune issues is that there's not just a one test or one size fits all approach. You have to look at the whole person and try to figure it out cohesively, holistically, all of that. The next thing is this person had an MRI and they mention enthesitis of the hips. They don't specifically say which entheses, but they mention enthesitis on both sides of the hips. That's interesting. Why is that? So the entheses are essentially the spot where tendons and ligaments insert into the bone. Enthesitis means that there's inflammation at that level. I can postulate a reason why a person could have enthesitis that has nothing to do with an autoimmune condition. For example, let's say somebody has a mild pinched nerve in the lower back. Because of that, they now have weakness in their glute muscles, their hip external rotator muscles. Because of that weakness, now the tendons where the muscle inserts into the bone are overworking, and now those tendons have become inflamed, tendinitis. That can look like enthesitis. In fact, that is a type of enthesitis. The fact that it's on both sides is interesting. The fact that it's in a young person makes it interesting. The fact that they have upper and lower extremity symptoms, again, is suggestive that there may be something more going on. So to me, enthesitis on both hips in this kind of presentation is very suspicious of possibly an autoimmune etiology. Absolutely, this person should see a rheumatologist to get properly evaluated. The rheumatologist should do an examination, see if there's any obvious findings consistent with an autoimmune disease. They'll look for any signs of inflammation in the joints. They'll look for, which can include swelling in the joints, classic tenderness, redness. They'll look for any other systemic findings. Let's say you've got redness in the eye or really dry mouth, or let's say a rash that could look like psoriasis. They're going to look for anything else that's suggestive that you could have a systemic autoimmune condition. The reason why is when you're trying to make a diagnosis for an autoimmune inflammatory arthritis, you're really trying to layer on the evidence to say, yep, you meet criteria for diagnosis X, or you don't meet criteria. In addition, the rheumatologist will, I think, in someone who's coming in with hand pains as well, they should hopefully looking for other signs of inflammation. Besides the enthesitis in the hips, they should probably also do an ultrasound of the hands to see if there's any signs of inflammation in those joints as well. Again, layering in the evidence to say you could have a diagnosis. They should probably do some antibody testing as well for various autoimmune conditions. Could include rheumatoid arthritis, ankylosing spondylitis as well. If you have other findings that could suggest another autoimmune condition, they may check additional antibodies. But then they should also be considering other non-autoimmune or non-inflammatory conditions as well. That could include, let's say, your thyroid is off, other hormones are off, maybe you're vitamin D deficient. They should be expansive in thinking all of those things if that has not already been checked by your primary doc. Please definitely try to maximize your conservative treatment options right now until you get a diagnosis. To me, that includes optimizing weight, anti-inflammatory diet, taking the right kind of over-the-counter joint supplements, things like glucosamine, omega-3, curcumin. In my experience, a lot of patients have already tried some of these kind of basic conservative treatments before they've come to see me. So at that point, we're trying to then decide what are next steps. If you still have symptoms, if you've seen rheumatology, if they feel like you could have an autoimmune issue, they may then start to consider treatment options if they think you have an inflammatory arthritis. But in this case, I think it's an interesting case. Young person, progressive symptoms, multiple joints. The enthesitis on the MRI on both sides of the hips is curious, very suspicious, definitely get checked out. Again, this is not specific diagnosis or treatment recommendations. Would recommend seeing a rheumatologist. If you're not getting more answers, get a second opinion. But I think overall there is a curious case, definitely should be further investigated. Hope that's helpful. Any other questions, please let me know. Until we connect again, have a good day and live well. Bye-bye.